have not had health insurance since 2019, intentionally. And it's not because I'm irresponsible or I don't value health. I refuse to play along with the system that profits off of people being sick. The truth is we do not have health care in America. We have sick care. And it's not just broken, it's completely backwards. We're building more hospitals every single year, yet we're getting sicker, more anxious, more dependent. Like, how does that even make any sense? So at the chiropractor office I used to work at, we used to spend hours educating our patients on why we didn't accept insurance. It wasn't because we were just trying to be like assholes about it. It was because we were trying to educate them that it is not actually healthcare. We refused to participate in a system that was keeping people sick, managing their symptoms versus actually solving them. I remember one woman I was talking to, she said she was paying $2,500 a month for her family of four just in the premiums. They hardly even use the doctor at all. She was staying stuck and chained to a job that she absolutely hated, all for the quote unquote benefits. And that is not healthcare. If you ask me, that's bondage. So people always ask, well, what about trauma care? Yes, of course. If my leg gets chopped off for some reason, I absolutely am going to go to the emergency room and get it sewn back on. But for regular health things, like actually maintaining and preventing disease, not just detecting it, preventing it, I'm not going to the doctor for that. Or the standard doctor anyway. I want to put my money towards things that actually move the needle, like chiropractic, a naturopathic doctor if I need to, soft tissue work. So a lot of people ask me, if I don't have insurance, then how does that work? Well, the whole healthcare in America is, number one, the biggest scam out there. Number two, it's not your only option. So there's tons of these crowd sharing insurances that are out there, and that's the one that I use. And I'm not an affiliate. I'm not getting paid to say this. I'm just telling you, you have options, and they are a fraction of the premiums of the other stuff. So that way, if you do have an emergency and your leg does get chopped off, like I talked about, that will be covered. But your typical visits and all the other crap that they make you pay, $500-$600 a month for, is not covered. You can instead field the money to things that actually move the needle. It just breaks my heart that, especially in this economy, people are going broke because they can't afford their premiums of health insurance that they have to have, or we've been brainwashed into thinking that we have to have. Or even worse, they stay stuck in these jobs that are creating these super high stress levels, actually deteriorating their health, but all for the benefits. It makes no sense. People just need to know that they have options. They can break out of the medical mafia or medical matrix, whatever you want to say. You have options. There's so many free options that are out there that God gave us freely. Fasting is an incredible way to detox your body, and it costs literally nothing. Getting your circadian rhythm, which is your sleep and wake cycle, in order, that's free. I could go on, but you get the gist of this. So if you agree with me, I'd love to hear it in the comments about what your thoughts are on the whole medical system, what you do for insurance. If you need options for the crowd sharing, I can totally tell you about the one that I use. Again, I'm not an affiliate. I would not get any kickback for it, but people deserve to know that there's options.